looking to migrate Australia, US, UK, Canada, or any other country. Okay, so we provide to complete the process easily. You can migrate. Today's webinar is for you for Australia, especially for AMC exam, Australian Medical Council exam. So related to this, you will see your journey, how you can migrate, how you can practice in Australia as a medical doctor. Or if you want to do PG also, you can do. So I will discuss on all those things. So this is academically team. So we are a Sydney. I'm talking to you basically from Sydney, Australia. We have our headquarters here, and we are we are the first tech in the world. We are providing assistance for healthcare professionals, whether you are a doctor, dentist, and all those things that I already mentioned earlier. This is myself. Basically, I have around 10 years of teaching experience in India, Malaysia, in Australia. In the last 6 years, I'm trying to create the awareness among the among communities to to my Australia. Especially, I'm just helping to the IMGs so you can easily can migrate to Australia because I only they are focusing on USM only and PLAB. But there is a lot of saturation for those two countries, so Australia can be a best option for you. And if you have any questions, you can actually also compare with PLAB, or if you want to compare with me, like for USMLE and AMC, also we can compare. So these are some of the faculties for this. This is Dr. Swipnil Sharma. She is MBBS MD from India, and she is basically when she passed this AMC exam. Now she is working here in Sydney. Same for Dr. Odara. She is basically a medical doctor from China. So many doctors are you might be from other countries. You graduate from like Philippines, Russia, China. So she's also one of them, and now she's working here in Sydney. We also have Dr. Zehra. We also have one more faculty. So we have around 4 faculty for this AMC program. So why Australia? You have to think about to migrate Australia. So Australia provide 190,000 permanent visa, PR visa. If you are planning to go UK, UK is, does not provide any PR visa directly. You have to go there and live for 3 years, then you need to apply for PR visa. Okay, but in case of Australia, you can apply once you pass this AMC2 and this training, then you are eligible to apply PR visa. There is currently a lot of vacancies available. Around 10,000 job vacancies are available for doctors in Australia, and salary is very high if you are comparing with UK and US also. So this is on an average. Even those surgeons make a higher salary in Australia, up to 3 CR per year. So these are some of the reports also from Australian Medical Association. They also are seeing a lot of GP shortage in Australia, and you can see the salary from this is the salary basically based on from seek.com.au. This is number 1 website in Australia when we are looking a job in Australia. There are some of the benefits like Australia, apart from high salary, quality of life, as they mentioned, and career opportunity is very good in Australia. Though the high demand, you can get a PR visa easily with your family. I'm sorry. Free education, healthcare access also free in Australia, and professional development. If you want to do any course or any workshop you want to attend, you want to do some research, they highly encourage in Australia to do.
Sir, you are muted. Kindly unmute yourself.
Okay, I'm sorry. Right. So like work-life balance in Australia very good. So you just need to work 40 hours weekly, 8 hours per day for 5 days. You will get a lot of time to yourself and your family members to give them. And professional development, if you want to do to attend some short course, so you can, or you want to do some research, you want to attend conference, and all those things highly encouraged in Australia. And Australia education is free. So if you have a like your kids, so they will get free education in Australia in top schools, and healthcare access also is free in Australia. In case of US, you need to buy the insurance, but here no need to buy anything. You just need to come to Australia. It's a universal health coverage in Australia. So what is this AMC exam? So in general, in Australia, there is a two pathway you can migrate to Australia. One is called standard pathway. Another one called, this is the specialist pathway. The standard pathway, anyone did MBBS, they are eligible to write this AMC, and once you pass this exam, you can register as a doctor in Australia. And secondly, is the specialist pathway. Those are did MBBS, sorry, MDMS from our home country, for example, India or Pakistan, whatever. And now you have a experience like 8 to 10 years, and you have very extraordinary CV. In that case, you can go specialist pathway. But if you did MD or MS, if you have 3 4 5 years experience, then still you need to go to AMC. Very low chance to get, get into that. So this is AMC exam is for you. Australian Medical Council exam. If you want to register yourself as a doctor in Australia, you need to pass this exam. There's a two-part, paper one and paper two. Paper one is a multiple choice question based exam. You can write this exam from your home country, and we will provide you the coaching for this for 4 months. So easily you can crack this in 4 months is more than enough time to crack this exam. So the eligibility for this exam, you must completed your medical degree. Okay, and this internship also is the compulsory. And if you not did internship in your medical school, then you need to complete in Australia. And finding that internship little bit hard. Okay, so if you did MBBS, for example, from India or Pakistan, then very easily you can get a job after EMC Part One exam itself. Or if you are from some other countries, completed, still you can write the exam. But internship must be included at least for 1 year in the medical school. So these are some of the steps you need to complete. The first step we call document verification. In simple words, so we will help you to complete this process, the step one. And once you done this, then you need to write this AMC exam. And after AMC exam, you are eligible to, you have to apply for your registration. You will get limited registration, and you can start working in Australia. So Australia, the only country in the world they allow to practice to work after part one. In UK, you need to write both exam, PLAB 1 and PLAB 2. Same for US Assembly. The US Assembly 1 and 2 you need to pass, and then you need to start your process for matching, for your agency in the US. But here, after part one, you are eligible to work in Australia. You will get a limited registration, means that you cannot perform the task individually, but you can work under the supervision of a RMP in Australia. The Biraj provide you the coaching for this English profession test like OET or PTE or IELTS, whatever you can give. But recommended for you to go for OET or PT. These are the easier exams as compared to IELTS. And then you need to pass this AMC Part 2 exam. Or many doctors ask me this question that, is there any alternate for this? So you can go WBA program, work-based assessment program. In that case, you no need to write AMC Part 2 exam. If you can secure this WBA program, you can directly go for this. This is a kind of internship, I can say, when you are doing in your medical school in India or Pakistan, like housemanship you did in Pakistan. So similar thing, you have to at least 4 to 5 departments. You have to work there at least for 2 months, and they will do your assessment. And I can see 99% of students pass in WBA program, and then you need to apply to get the registration done. These are some of the documents required, like your degree, transcript, work experience, if any, if you have valid passport, government ID proof, passport photograph, and medical registration if you have. So English score basically required 7 men individual in IELTS, or PT score 65, or OET 350 or B, grade B required for English in Australia. In case of UK, you need 7.5 in IELTS or equivalent in OET in UK, but here in case of Australia required 7. And so we provide live classes, and and then if you have any questions, you can ask our faculties, and we also record those sessions. So you will get later on the recorded session if you miss any class, and you can ask any questions from our faculty. And we also have a community portal for you, especially so you can directly interact with the faculty and ask your doubts if you have anything later on. So for this AMC exam, basically they will give you around 150 questions and 3.5 hours duration. Okay, and no negative marking for this exam, and we will provide for coaching for 4 months. And the passing marks, basically this in this exam, there will be like 0 to 500 scale. Okay, and you need to score 250 in order to pass this exam. And once you pass all those things, then you are eligible to apply PR visa, permanent visa like 190, 186, 189 PR visa, also sponsored visa like 491, regional sponsored visa, and like these work visa also eligible for you. So this is we provide live classes, and then a lot of mock tests, study materials, and support and all those things. So you can crack this exam. And we also provide the fees. Our team will give you. We have a lot of discount, and basically not discount. The scholarship is ongoing, so you have to give the scholarship test, and then based on your score, we will give you the scholarship for this program. And we have a lot of student paths from academically so far from different courses. And if anyone is from Sydney, visit our office, and I'm here, so you can visit me at any time. These are some of our basically media highlights recently from Hindustan Times and News Nation and Outlook recently. I think next week there's another article is coming in Times of India. Here are some of the reviews from students, and we are providing the financial assistance like loans. So you can pay the fees in 6 months, 9 months, 12 months without paying any interest rate. This is for Indian citizens. But it is for everyone. So we have a scholarship program called ASAP, Academically Scholarship for Abroad program. So you can avail this opportunity. These are some of the numbers from our team. So if you have any questions, you can directly WhatsApp us directly in these numbers, or you can email us. You can visit our website. And someone is in Sydney, you can visit me. This is my office. And I also want to, so if you guys can visit our YouTube channel, we have a specific YouTube channel for AMC aspirant. It's medical doctors, basically. If anyone want to migrate to any country, so we only upload the content exam or PLAB exam, USMLE exam, ADC exam. So related to those content you can find on this YouTube channel. So you can subscribe. Or if you have any questions, you can comment. I always reply to them. Yes, please. Yes, so please one by one. Hi, Navdeep, can you please unmute?
Sir. Good evening, sir.
Good evening.
Sir, actually, basically, I am a pulmonologist. I have done my degree in 2016, MD Pulmonary Medicine. From that 2016, I am working as a physician and also as an program officer from 2016 till now. So
Okay.
my experience is about to be 8 years.
Okay, I mean, you need to go, but this is, as I mentioned earlier, to getting a specialist pathway, not just the experience. So this is the main problem. Indian doctor, Pakistani doctor, they think that only clinical experience can help. In abroad, whether it is USMLE for US, PLAB for UK, AMC for Australia. They also see some additional things in your CV. So if you have very extraordinary CV in your field and you also did some research, some publication, some grant, and you also did some, like community work, maybe you are working some
Yes,
NGO.
yes, sir. I was the sir. I was the program officer in TV program as well as a COVID program from during the COVID and a TV program from last 8 years. I am managing the whole of the district as a TV program officer from last 8 years as a
कहते हैं,
district program officer plus clinician.
हाँ, ओके। तो अभी आप क्या क्वेश्चन क्या आपका ये बताइए मेरे को आप।
Sir, should I go through the specialist pathway or AMC one?
यू कैन ट्राई, देयर इज नो हार्म, आप ट्राई कर सकते हो उसके लिए। अगर आपको वो नहीं मिलता है तो फिर आपको AMC पे जाना ही पड़ेगा। आप
Okay,
ट्राई
sir.
कर लो, अगर आपको 8 साल का एक्सपीरियंस है, इफ यू थिंक दैट कि आपकी प्रोफाइल इतनी स्ट्रांग है तो आप उसको मस्ट ट्राई करो, मैं तो ये कहूँगा।
Or sir, it is a good pathway. I should go for AMC first, then go for a specialist pathway after clearing AMC 1 and 2.
Yeah, definitely, if you are going from it, then you are basically learning the system. This is from beginning से आप जा रहे हो तो AMC pathway highly recommended रहता है. But since you have 8 year experience also, so you can try that as well. Okay.
Sir, the duration of the PG is included in the experience or not?
No. इन जनरल इंक्लूड कर लेते हैं वैसे, क्योंकि सारे लोग तो जॉब करते हैं, क्योंकि रजिस्ट्रेशन तो हो जाती है MBBS के बाद में, तो वो काउंट कर सकते हैं। बेसिकली इस ऐसा है कि आपका CV कितना स्ट्रॉन्ग है, क्योंकि नाउ यू आर फाइटिंग फॉर लाइक वर्ल्ड वाइड डॉक्टर्स, इट इज नॉट जस्ट इंडियन पाकिस्तानी,
Definitely.
because maximum doctors practicing in Australia, maximum doctors are from UK. UK के डॉक्टर उल्टा ऑस्ट्रेलिया में प्रैक्टिस करने आते हैं, यहाँ पर जॉब करते हैं लोग।
Okay, sir. So,
हाँ,
sir, अगर ये experience count हो जाता है 3 years, then it will be more than 10 years.
हाँ, तो आप दिखाओ इसमें, ये उसका इतना वेटेज नहीं है,
नहीं है, ठीक है।
नंबर ऑफ ईयर्स, ये ईयर से मतलब नहीं है। आपने अगर कोई एक्स्ट्रा ऑर्डिनरी, मैंने बताया अगर आप पल्मोनोलॉजिस्ट हो तो आपने कितने रिसर्च किया है, कितना पब्लिकेशन किया है, कितने बच्चों को आपने गाइड किया है, ये सारी
Okay.
चीजें भी देखी जाती हैं। इट इज नॉट जस्ट द क्लिनिकल एक्सपीरियंस कि भाई आप एक क्लिनिकल, मतलब इंडिया में यही तो प्रॉब्लम है, सारे लोग क्लिनिकल पे ध्यान देते हैं, बाकी चीजों पर ध्यान नहीं देता
बाकी
कोई।
चीजों पे नहीं देते हैं।
मगर फॉरेन में ये और भी चीजें देखते हैं, लोग देखते हैं रिसर्च कर रहे हैं नहीं कर रहे, भाई आपने अपनी फील्ड में आपने क्या क्या किया, राइट, तो वो भी इसको कंसिडर करते हैं।
Sir, I have done 4 to 5 publications, but not more than.
हाँ, तो आप ट्राई करो, 4-5 भी है तो कोई दूसरे के बाद में शायद वो भी ना हो।
Okay,
मैं
but I want to go for AMC 1 and 2, then I will go for specialist pathway. It will have more chances to be selected after the AMC 2 in specialist pathway.
100% चांसेस है। अगर आप AMC 1, बेसिकली देयर इज अ गुड चांस फॉर यू टू गेट ए जॉब। अगर आप AMC पार्ट 1 कर ले तो आपको 10 साल एक्सपीरियंस है ऑलरेडी, आपको जॉब ही मिल जाएगा डायरेक्टली।
Definitely, sir. Sir, what will be the maximum time if I am going to start from tomorrow? What will be the total whole time for the procedure?
नवदीप, हम लोग तो कराएंगे आपको प्रिपरेशन 4 मंथ का।
ठीक सर।
और 4 मंथ में बेसिकली आपको यू विल बी गुड टू गो टू द एग्जाम। और एग्जाम इसमें क्या है, मंथली होता है। दिस इज एडवांटेज इन ऑस्ट्रेलिया, दिस इज अ मंथली एग्जाम। फॉर एग्जांपल फिलहाल फॉर यूके यू नीड टू वेट एटलीस्ट फॉर 1 ईयर, वहां पर वेटिंग चलती है यूके में।
डेफिनेटली।
तो एडवांटेज होती है, तो एटलीस्ट 6 मंथ तो आपको लग ही जाएंगे अगर आप अभी ज्वाइन करते हो तो।
मतलब मैक्सिमम सर आई एम गोइंग टू सेटल्ड इफ आई क्लियर द एग्जाम 1 ईयर नेक्स्ट अप टू नेक्स्ट ईयर।
नहीं, आप ऐसे लोग, बहुत सारे लोग टाइम ले लेते हैं, आई डोंट नो व्हाई, बिकॉज़ ज्यादा टाइम की जरूरत नहीं। आप बस 4 महीने 4 घंटे 5 घंटे पर डे पढ़ना है आपको, 4 मंथ मैक्सिमम है, मिनिमम 3
डेफिनेटली
मंथ।
सर।
तो
ओके सर।
उसमें ये एनफ टाइम होता है आपके लिए पास करने के लिए। और ये एग्जाम इट इज नॉट वेरी टफ एज कंपेयर टू इंडियन नीट पीजी। इफ आई कंपेयर दिस इंडियन नीट पीजी, इतना टफ एग्जाम नहीं है पार्ट 1, ठीक है। इसका पासिंग रेट ही है अप टू 70%। 60% ऑन एवरेज बच्चे पास करते ही करते 60-70% इस एग्जाम को।
ओके सर। डेफिनेटली ओके सर, आई हैव डन।
ओके, थैंक यू नवजीत। यस डॉक्टर सलाह तारिक, कैन यू प्लीज अनम्यूट? Yes, Abid Mahmood, can you please unmute?
Hello, sir.
Yes, hello. Hi, Shubham.
Hello, sir. Good evening from
Good evening.
India.
Yes, good, sure.
So I completed my MBBS from Russia and then cleared my FMG and after clearing my FMG, I'm working as a resident medical officer in Delhi.
वेरी गुड. कब पास किया है एफएमजी? कांग्रेचुलेशंस. लास्ट
Yeah,
टाइम तो 10% लोगों ने पास किया ना, राइट? लास्ट एग्जाम में
no, sir. I passed 2017.
2017. ओके ओके.
Yeah,
That's good.
and after that, I'm working as a resident medical officer in Delhi only. So I have around 5 year experience. So I want to ask, sir, like. First, we will go for AMC 1 and then AMC 2.
Hmm.
Sir, if I want to start my PG, so what will be the process for PG? Like after you
Basically,
join PG, or
Australia and UK, the PG process is the same. So you need to write AMC Part 1, Part 2, or PLAB 1, PLAB 2 for UK. Because we provide coaching for PLAB also. We provide coaching for AMC. We provide coaching for US Assembly also. Okay. So I'm not biased here because we provide
no, no,
whatever you want, you can go. So basically UK में क्या होता है और ऑस्ट्रेलिया में, दोनों में जैसे आप AMC Part 2 कर लोगे या PLAB 2 करोगे, तो यूके में 2 साल की वहां पर वो करनी पड़ती है, PGY1 PGY2 करना पड़ेगा. उसके बाद में आपको रेजिडेंसी करनी पड़ती है यूके में. सेम इन ऑस्ट्रेलिया में आफ्टर फर्स्ट ईयर 1 साल आपको जहाँ पर काइंड ऑफ इंटर्नशिप बोल लो उसको या हाउसमैनशिप बोल लो, वो करनी पड़ेगी AMC 2 के बाद में. एंड देन यू हैव टू अप्लाई कि आपको किस में PG करनी है.
okay. So, sir, during PG, we have to pay fees or they will pay us?
नहीं, स्टाइपेंड यू विल गेट, बट इन जनरल फीस तो पे करनी होती है, बट बहुत ही लो होती है. जैसे लगा लो कि इंडिया में इफ यू गॉट एनी PG सीट एनी मेडिकल कॉलेज, इवन एम्स की फीस होती है, राइट?
Yeah.
तो फीस बहुत ही कम होगी. मतलब अगर एम्स अगर आपको 50,000 रुपए दे रहा है पर मंथ के, और वो मार्ट भी 10-15,000 रुपए फीस लेगा पूरे साल के, तो ऐसे ही यहाँ पर भी फीस होती है, बहुत ही लो होती है और
Actually,
आपको पैसे मिलते हैं उसमें.
me and my partner, we both are planning for AMC.
हाँ, तो वो उसमें वो आपको पैसे मिलते हैं शिवम. यहाँ पर वो बेसिकली यू नीड टू वर्क इन द हॉस्पिटल. जो आप
Okay.
PG करते हो ना, PG 1, 1, 2, 3, बेसिकली PG भी यहाँ पर 3 to 6 ईयर का होता है. तो इस डिपेंड कि आपको कौन सी ब्रांच करनी है. फॉर एग्जाम्पल अगर आपको इंटरनल मेडिसिन करनी है या आपको तो उसमें 3 ईयर्स में हो जाएगा. पर आपको सर्जरी करनी है फॉर एग्जाम्पल, तो
Yes,
4 to 6 ईयर्स लगेगा. तो वो डिपेंड करता है कि कौन सी ब्रांच आपको मिल रही है. इन जनरल पर पैसे मिलते हैं उसको नहीं है, और वो जो फीस होती है बहुत ही लो रहेगी.
sir, branch कैसे decide होती है कि कौन सी branch मिलेगी?
नहीं, वो तो आप अप्लाई करोगे. जहां जैसे इंडिया में क्या होता है कि नीट PG आप एग्जाम देते हो और आपको नहीं पता कि कौन सी ब्रांच मिलेगी. ब्रांच मिलती है आपके नंबर की बेस पे, राइट?
Yeah, right.
और यहाँ पर ऐसा नहीं है. यहाँ पर आप चूज करोगे आपको किसमें करना है, तो आपको जस्टिफिकेशन देनी होती है व्हाई यू वांट टू गो इन सर्जरी.
Okay.
फॉर एग्जाम्पल नाउ यू मेक स्टोरी कि सर मैंने 5 ईयर बैक मैंने MBBS किया और मैं इंडिया में प्रैक्टिस कर रहा था, मैंने वहां पर सर्जरी में मेरा बहुत इंटरेस्ट है और ये वो. और यहाँ पर जब आप आ जाओगे AMC के बाद में,
Can you please use English?
oh, hi Anand. Yes, so basically you have to make your own story. So if you are applying for example surgery or internal medicine, so you have to show your interest in that particular branch. So in that way you can make a little story, and so here there is no universal kind of exam like in India. We have a NEET PG exam, right? Anyone wants to go PG, so they have to go to write this exam, and based on your marks they will allot you the branch or college, right? But here there is no such exam. So each college have their own exam. For example, you want to apply, for example, your partner, she want to apply option gynae.
Yeah.
Let's suppose. So in that she need to apply for option gynae, and she has to make her own story why she want to opt this branch. She want to go on this. So your previous आपका experience, and you also did maybe whatever you did, all those things. So you have to be in line to the option gynae.
Okay. So, sir, after AMC 1, we can start job, we can start job in hospitals, right?
Yes, in Australia, you are eligible to work in Australia. So Australia, there are 2 jobs. One is called JMO, Junior Medical Officer.
Okay.
Another job called RMO, a Resident Medical Officer. Both
Okay.
jobs you are eligible, but those are very very freshers. They might hired as a JMO, Junior Medical Officer. Those have some experience like you, for example, they may hire you as a RMO. There is a difference that you will get a very limited supervision. GMO need a more supervision, while you are working in the hospital. Shivam, anything else?
Hello, sir.
Yes, I am.
Sir, I want to ask what's the basic starting salary for the junior medical officer?
Around 70 to 100,000.
70
Here the salary, apart from salary, they also give 12%. Is called 10 to 17% in between. 10 to 17%. They also give additional salary. Is called bonus.
And what about the working hours?
40 hours weekly, 8 hours per day.
And if we do the overtime?
Yes, if there is a, then they will pay you. There is a basically in Australia in general, if you are working Monday to Friday, you will get a flat rate. And if you are working in Saturday, you will get 1.5x. And if you are working in Sunday or public holidays, you will get a 2x that day salary. And if you are working additional hour, more than 15 minutes, if you are working in the hospital, you will getting paid.
Okay. Thank you, sir.
Thank you.
Hello.
Yes, Ashita.
Hello, sir. So, actually, my question is right now I'm preparing for NEET PG exam, and this is my second attempt actually. And I'm working. I'm a foreign graduate, and I have 2 years experience in India after clearing my MCI exam. So I want to. I'm a little bit unsure that whether I should like start my PG career in India or I should go right away for AMC
Ashita,
one
I have
and
already, I think, mentioned in my slide, our own faculty, Dr. Sipil Sharma. She is
yes
a
sir.
Indian graduate. She is from Pune Medical College.
Yes sir.
MBBS, MD she did from there. She is also a NEET PG qualified, And
Yeah.
then she worked 3 years in India. After that, she was assistant professor.
Yes sir.
And then she decided to move Australia. And then
Yes
she
sir.
ran the same exam and she's now practicing here. So,
Yes.
so this is the right time for you to decide if you really want to work in abroad. No need to go for, I think, NEET PG again.
So how many years will it take to be as qualified as a specialist in Australia if I start now? Like
I mean,
I'll sit after 6 months.
you cannot not compare with especially salary here 3 CR. In
No,
India,
no,
it's
not sir.
I'm just earning the outcome
Okay,
you
okay.
see. The time will take more. In India, it may take just 3 years, right?
Okay.
In Australia, it may take 3 to 6 years. As I mentioned,
Yes, sir.
it depend on the branch.
Okay. Yeah.
Like surgery takes 4 to 6 years.
Yeah, yeah,
Like
yeah, understand.
medicine or option gynae will take around 3 to 4 years.
So I can consider that you're suggesting if anyhow in future I want to settle in Australia, then I should go right. I should start preparing for AMC only, not gonna wait
No,
for PG.
even I suggest if anyone want to go in abroad, settle
Yeah,
not just the Australia. If you are thinking to want to settle down abroad, so I can say
yeah,
Australia can be a best option if I compare with USMLE plus PLAB UK and
yeah,
AMC Australia. So Australia,
mhm.
because many Indian doctors they are just focusing on USMLE and PLAB only. They don't
Yeah,
know
yeah.
the AMC. So
Yes, sir.
right now, I can say very, very good opportunities here. And they give directly PR visa, permanent visa. You can live and work here. After 3 years, you can get your Australian citizenship if you want. If you do not want, it's up to you.
Okay, sir. Thank you, sir.
Thank you. So basically, you guys please see the end outcome. It is not just how much you are earning as a GMO or a RMO. This is not your basically your actual salary. Actual salary you will get once you become a the full-fledged GP or you will be a specialist surgeon. At the time you have to count how much you are going to earn. So whatever they are paying while you are doing GMO or RMO, it just they are giving the stipend basically. 70,000, 80,000 is not very low. I can say it's a very a decent amount money. When I came to Australia to do my PhD, I was getting only salary 28,000 per year. So me and my wife, we survive in Sydney. So if you are getting 70, 80,000, this is a very, very good amount, I can say. Okay. Yeah, yeah. Next, please.
Hello, sir.
Hello.
Yes, hello.
Sir, I have a question. I'm a fresh graduate from Afghanistan, and I haven't entered my council exam in Afghanistan because due to governmental problems, they're not taking the council exam from girls now. So, can I join or attend the AMC one without entering my own council exam?
Basically, if your medical college are approved, in the World Medical Directory, you can write the exam. Okay.
Yeah, they're approved.
And have you did your internship also?
Yeah, I finished. It's now 1 month ago. I finished my house job.
Yes, then you can.
And after AMC Part 1, we can have paid job in Australia, yeah?
I mean, because you do not have any work experience, right? As you mentioned that.
No, I
Yes.
don't know. I'm fresh and I don't have any experience yet.
Yes, but still you are eligible to write this AMC exam. So in general, worldwide, you only can practice after part 2 exam only. Only Australia is giving you this additional the age you can work in Australia after AMC 1. So since you are fresher in your country also is they are not give you the flexibility to register yourself as a doctor right there. So in that case, you can consider AMC part 1 and
Mhm.
and try for a job after part 1. If not, then you can go for part 2. You can write at any time.
Okay, sir. And sir, for example, for taking visa, can we apply individually or it's allowed for family as well? For example, I'm married, and my husband is not doctor, so
I mean,
um,
yes, I understood. So in general, in Australia, any visa you are, even if you are coming study visa, for example, you want to do any study in Australia, still if you are as a student, if you are getting a visa, your partner will get automatically the visa. So or if you got a job after AMC 1, so your partner will get the job the visa automatically. But he just need to write the English test. Okay, this is a minimum requirement for him, 5.5. But for you as a doctor, you need to score 7.
okay, sir.
So dependent need very minimal English.
Thank you, sir. Thank you so much.
Okay, thank you. Yes, next
Hi, sir.
please.
Hello,
Good
good
evening,
evening, sir.
I can't.
Hello. Hi, sir. Yeah, I'm actually, I have done my PG in internal medicine and I have passed MRCP part 1 and part 2. Am I getting any extra advantage while going through the specialist pathway, or am I supposed to go through the AMC 1 and 2?
How many years you have work experience after your PG?
2 years.
Then I don't think so. They will consider your application. This is very, very low experience. At least you should have maybe 8 years or 10 years experience. Then because here the competition is very, very high for this specialist pathway. So if you think about Australia, so you can go this AMC 1 and AMC 2, and then you can practice here.
Sir, is my MRCP part 1 and part 2 degree as having any extra advantage, or is
This can be give you when you are looking a job, basically, but immigration and all those things are the same. That you need to pass the exam. But when you are applying the job, obviously at the time they'll give you the advantage.
sir, after writing AMC part 1, can we apply for job, or after finishing AMC part 2?
Yeah, after AMC part 1 also there is a good chance for you to get a job.
Okay, sir.
And I want to make one more thing here. The advantage right now, even part 2 also you can write online from India itself. Earlier, before COVID, that part 2 you need to be in Australia. So they removed this condition. This condition is still ongoing. I don't know. I mean, when they are going to change or not in future. But as of now, you can write this part 2 as well from your home country.
Is part 1 and part 2 both objective type, like
No.
best of?
No. Only part 1 is the objective type, multiple choice, but part 2 is the OSCE exam. Do you have any idea OSCE?
Yes, sir. Yes, sir. Yeah, like paces.
Guys,
Maybe.
yes, I think you guys already know. So OSCE part 2 is the OSCE exam, or in simple word, you can say practical exam or clinical exam.
So if you are like AMC part 1, will I have to study all the whole subjects as per in MBBS, like, or can we go have write
We
some?
have a very limited syllabus. We are here to help you to pass the AMC exam. We are not going to again, teach you again about the MBBS. You're already a medical doctor. So we are here to help you to crack the exam basically.
Okay, sir.
I mean, no need to study the whole syllabus, but maximum the clinical subject you need to study.
Okay, sir. Okay, thank you, sir.
Thank you.
हेलो सर,
Yes, hello.
क्या हम ऐसे कर सकते हैं कि प्लेब 1 एंड प्लेब 2 दे के फिर ऑस्ट्रेलिया में जॉब करें?
तो आप प्लेब 1 यूके की नहीं दे रहे हो, तो यूके में जाकर जॉब करोगे, जहाँ क्यों करोगे आप? प्लेब 1 प्लेब 2 यूके के नहीं, ऑस्ट्रेलिया के नहीं, तो है नहीं। In general क्या होता है लोगों का, basically this is a misconception. They think that we can write plab, then we can go to Australia. Why Australia has to accept the plab? They only accept once you got your full registration in UK, then you can transfer.
ओके,
Yes,
तो
then अपने yes क्या
फुल रजिस्ट्रेशन कैसे होता है?
वो जब आप प्लेब 2 करोगे तो वहां पर PGY1 और 2 वहां पर जॉब करनी पड़ती है 2 साल यूके में, और उसके बाद आपकी रजिस्ट्रेशन हो जाती है, तब आप कर सकते हो।
ओके, तो फिर पीजी ऑस्ट्रेलिया में करना है तो?
हाँ, तो फिर आपको रजिस्ट्रेशन वो जो है आपका ट्रांसफर हो जाता है यूके से ऑस्ट्रेलिया में, और फिर आप पीजी वहाँ ट्राई कर सकते हो ऑस्ट्रेलिया में।
ओके,
तो आपने प्लेब 1 और 2 पास कर लिया है?
नहीं बाकी है।
ओके।
अस्सलाम वालेकुम सर।
अस्सलाम।
कैसे हैं सर?
बढ़िया, ये बताइए।
सर असल में पूछना ये था कि मैंने कैप्स वगैरह कर लिया है, पीटी वगैरह भी कर लिया है ना, तो यूआई सबमिट की है, लेकिन अभी फार्मासिस्ट को इनविटेशन नहीं आ रहे। क्या मसला चल रहा है? क्या आपको है आइडिया के कुछ?
दिस इज वेबिनार फॉर एएमसी ओनली, दिस इज नॉट फॉर फार्मासिस्ट। द फार्मासिस्ट को तो आप पूछिए, आई मीन आई हैव नो आइडिया, बेसिकली दिस इज फॉर एएमसी। प्लीज आस्क द क्वेश्चन related to AMC. This is for medical doctors, this webinar.
Okay, sir.
Hello, sir.
Yes.
Sir, Australian postgraduate is valid in India or not?
क्या धर्मवीर?
Australian postgraduate is valid in India or not?
Australia,
after doing postgraduate in Australia, we will work as a PG in India.
Yes, can. तो बेसिकली पहले तो आपको ये मालूम होना चाहिए ऑस्ट्रेलिया इज हाई इनकम कंट्री। हाई इनकम कंट्री जो फर्स्ट वर्ड जिसको बोलते हैं ना ऑस्ट्रेलिया, उसमें से आता है। तो यूएस, यूके, कनाडा, ऑस्ट्रेलिया, इन सब की डिग्रीज वैलिड रहती है वर्ल्ड वाइड, कहीं भी आप प्रैक्टिस कर सकते हो आप। दिस इज नॉट लाइक रशिया, चाइना से या फिलीपींस से आपने किया और फिर वहां पर भाई इंडिया में एग्जाम देना पड़ेगा फिर से। तो इन जो कंट्री, इवन ऑस्ट्रेलिया तक allow करता है, if you are from US or UK directly you can practice in Australia, no need to write the exam। तो फर्स्ट वर्ल्ड कंट्रीज का यही एडवांटेज है, कोई भी अगर कनाडा से अगर उसको मूव करना है ऑस्ट्रेलिया में, ही कैन। तो इन कंट्रीज में बहुत ही इजी है कि आप इंडिया में या कंट्री में कहीं भी जाके आप लोग प्रैक्टिस कर सकते हैं विदाउट राइटिंग एनी।
ड्यूरिंग पोस्ट ग्रेजुएट हाउ मच स्टाइपेंड वी विल गेट?
ये डिपेंड करता है उस पे जो है बेसिकली जो वो होता है ब्रांच टू ब्रांच, पर वो मॉडर्न है ना, 4-5 लाख तो होते हैं पर मंथ।
अरे AMC 1 करने के बाद कितना चांस रहता है जॉब मिलने के?
तो जॉब मिलने के चांस आपके अपने ऊपर ही है, आपको जॉब का इंटरव्यू क्रैक करना है, ठीक है। तो वो जो आपका सीवी है, कितना आपने एमबीबीएस में वो किया है, कितना आपको एक्सपीरियंस है, क्या किया, उसकी बेस पे ही आपको वो बुलाएगा, ठीक है। और जैसे गुड चांस बेसिकली मैं बोलता हूँ, अगर आपके पास एटलीस्ट 1 year का एक्सपीरियंस है, there is a good chance.
Okay.
Sir,
Sir,
after doing internship in India, like we just finished our MBBS 4 years, then we have mandatory 1 year of internship. So after we finish that 1 year of internship and we give AMC one, do we still have a good chance to get a job after AMC one,
Yes, वैसे भी वो
or should we for
इंडिया का जो इंटर्नशिप है वो एक्सपीरियंस में काउंट हो जाएगा, बट एटलीस्ट जितना एक्सपीरियंस आपका बढ़ता जाएगा इतनी ज्यादा चांस रहेगा जॉब का.
And sir, after we suppose once we crack AMC 1 and AMC 2, the main goal would then be to enter PG, right? So, I mean, as an IMG, since we hear a lot of stories that IMGs are not usually preferred for training posts. Is this true? I mean, do IMGs?
ऑस्ट्रेलिया में ऐसा नहीं होता. ऑस्ट्रेलिया में गवर्नमेंट जॉब इजीली मिल जाती है. यहाँ पर लोग गवर्नमेंट जॉब करते हैं. मैं पीजी की बात कर रहा है. यहाँ का जो हमारा जो नंबर 1 जो हॉस्पिटल है पूरे ऑस्ट्रेलिया का वो है सिडनी हॉस्पिटल. ठीक है, यहाँ पर चिल्ड्रन हॉस्पिटल. ठीक है, मैं तो वहाँ जॉब करता हूँ. उसका जो हेड है ना सर्जरी का, जो उनका डीन है वो इंडियन है राइट नाउ.
ओके.
इंडियन यहाँ पर किसी भी हॉस्पिटल में आप जाओगे आपको शक्ल देख ले जाएगा कि यहाँ तो इंडियन है. ये आसपास हमारे सब कॉन्टिनेंट इंडियन है, पाकिस्तानी है, नेपाली है, बांग्लादेशी है या श्रीलंकन है. आपको 1/3 हर 3 डॉक्टर में एक बंदा तुमको एक IMC हमारे यहाँ का ही मिलेगा. तो अभी वो टाइम नहीं है. और यहाँ पे
तो फिर that is the if that is the case, sir, if that is the case, because मेरे को यही क्वेश्चन था जिसका मेरे को आंसर कहीं नहीं मिलता. मैंने आपके भी जो वीडियो, if that is the case, if Australia is so open and willing to appoint IMGs, then why is it that USMLE and PLAB are the preferred pathways when it comes to PG, but Australia इतना एक्सप्लोर नहीं हुआ है? मतलब ऐसा क्यों है सर?
किसी को पता ही नहीं है यहाँ के बारे में. हम जब बात करते हैं किसी कॉलेज में वेबिनार में देता हूँ तो हर एक बंदे को वही, हमें तो पता ही नहीं था. इवन इटसेल्फ मेरे को ही नहीं पता था. मैं यहाँ तक जब आ गया, व्हेन आई केम टू ऑस्ट्रेलिया, यही जब मैं इंडिया में था तो मेरे को ये मालूम था कि मैं स्टडी करने जा रही हूँ मेरे को ऑस्ट्रेलिया में, और उसके बाद ही वहां पे आप रह सकते हो. तो 40-50 लाख रुपए का आप इन्वेस्टमेंट करो. तो पीपल डोंट नो अबाउट बेसिकली द ऑस्ट्रेलिया. दिस इज द मेन रीजन. एवरीवन नो बिकॉज यूएसएमएलई इंडिया से बहुत लोग जा रहे हैं पिछले बहुत साल से, और यहाँ पर लोग आए बहुत ही कम लोग आए यहाँ पर. हाँ, पिछले 7-8 साल से अभी इंडियन आना चालू हुए यहाँ पर. उससे पहले यहाँ पर जो मेन जो यहाँ की जो पॉलिसी भी थी ना इमिग्रेशन वाली, वो भी इतना फेवर नहीं करती थी इंडियंस को. अभी राइट नाउ तो अभी तुमने देखा हुआ वो जो हमारा प्राइम मिनिस्टर है 2 बार जा चुके हैं इंडिया, वो ऑस्ट्रेलिया के. और इवन इंडियन प्राइम मिनिस्टर मोदी भी यहाँ 2 बार आ. अभी इतने टाई अप चल रहे बहुत सारी. अभी इन फ्यूचर में अगले 3 से 5 साल में बहुत ज्यादा एंगेजमेंट बढ़ने वाली दोनों कंट्रीज की उसमें. और अभी इंडियन जो है यहाँ पर राइट नाउ नंबर 3 पे है ऑस्ट्रेलिया के अंदर माइग्रेशन में. एवरी ईयर 190,000 जो PR वीजा मिलता है उनमें से 40 से 50 हजार सिर्फ इंडियन सिटीजन को मिलता है वीजा, PR वीजा.
राइट.
और इंडियन से एक बात और है कि इंडियन जो है ऑलवेज यहाँ पर जो ना एक अच्छी पोजीशंस में है. मतलब IT इंजीनियर्स हैं, हेल्थ केयर में डॉक्टर्स हैं. आपको कहीं भी आप जाओगे आपको इंडियन बहुत मिल जाएंगे आप. तो पिछले 5-6 साल बहुत सारे लोग आ रहे हैं. उससे पहले यहाँ पर इतना नहीं था, तो लोगों को इतनी अवेयरनेस नहीं थी. बहुत बंदे को सोचता कि यूएसएमएलई और प्लैब पे जाना है. अभी प्लैब वगैरह यूएस सैचुरेशन हो गई है वहाँ पे इतना. तो फिर लोग अभी यहाँ पर प्रेफर करते हैं. मैं कहता हूँ ऑस्ट्रेलिया इज अ वेरी गुड कंट्री बेसिकली. और इतना यहाँ का जो वेदर भी जो है ना वो बहुत ही फेवरेबल है इंडियंस के लिए.
राइट.
हेलो सर, आप लोग इस AMC के लिए प्रिपरेशन वगैरह कोई क्लास कराते हैं कि नहीं?
अरे यार इसलिए तो हम तुमसे बात कर रहे हैं, हम वही तो कराते हैं
सर. तो कब से उसके बारे में थोड़ा बताइए ना कि कब से कराएंगे, क्या है कैसे है?
अरे क्लास तो भाई चल रही है हमारी. क्लास तो हर महीने हम चलती रहती है. हमारा तो शायद 5वां बैच चालू कर रहे हैं हम आपके लिए. तो हमारा तो बैच चल ही रहे हैं. हमारे बहुत सारे बैच चल रहे हैं ऑलरेडी जो बच्चे हमारे पास में कर रहे हैं. हम हर महीने उसका
कितना दिन कराते हैं, कितना पैसा चार्ज करते हैं सब?
वो 3.5 महीने से 4 महीने का हम लोग कराते हैं. तो उसमें हम लोग लाइव क्लास लेते हैं 10 आवर्स वीकली. और वो सारी हाँ वो रिकॉर्डेड होती है सारी सेशंस. और वो आप लाइव अटेंड कर सकते हो, और अगर आपने कोई मिस कर लिया तो उस केस में आपको रिकॉर्डेड मिलेगा, और स्टडी मटेरियल मिलता है, और मॉक टेस्ट मिलते हैं हमारे पास में जो है इंडिविजुअल चैप्टर वाइज, और ग्रांड टेस्ट बहुत सारे मिलते हैं हमारी एप्लीकेशन में, वो सारी चीज़ें हम लोग देते हैं। और ये जो फीस के लिए बेसिकली भी स्कॉलरशिप का एक एक टेस्ट आपको देना होगा इस ऐप का, और उसकी बेस पे फिर आपकी फीस वो होगी। ठीक है, तो हमारी टीम आपसे कॉन्टेक्ट करने लगी अभी कुछ देर के बाद में।
Okay. Good evening, sir.
अगर आपने कॉन्टेक्ट नहीं किया तो यू कैन लीव योर फोन नंबर इन चैट बॉक्स।
Good evening, sir.
Good, sir. Yes.
Sir, I'm currently an intern in India.
Yes,
So
Varun.
my internship will be getting over around March 27th. So I
Okay.
wanted to know, based on your current courses, if I
Hmm.
wanted to write AMC 1 this year,
Yeah.
and after if I pass the AMC 1, you said that we'll get a job as a GMO, right?
Yes, GMO or RMO, you are
Okay.
eligible to apply both jobs, but based
Okay.
on your previous experience, the
Okay.
hospital may offer you as a GMO. For example, you are a fresher.
Yeah.
Most likely, they will offer you GMO. But someone
Correct.
has
Correct.
experience, like 1 year experience, for example, for
Okay.
him, they might offer like RMO.
Okay. Okay, sir. I'm actually a fresher only. Like immediately as soon as I finish MBBS, I'm planning to write this exam. Also, I wanted to know in your course that you will provide the coaching. Apart from that, will you also help in finding a jobs and
We
visa?
are a tech company, so our job to help you to pass the exam. But apart from this, we
Okay.
will help to how you can apply for registration. Our own faculty is basically Indian, right? So
Okay.
not just we will help you, we will also give you the guidance, how you can start looking a job, in which
Okay.
website, consultancies, your CV, cover letter, or what kind of questions they may ask you in the interviews for your preparation. All those things we will give you the information.
Okay. So this will happen like in a regional area where I'll be able to get a job, right? Not in a
Yes,
metropolitan.
definitely. I mean, the availability of jobs in the regional area, but regional area is not our regional area like Indian.
Yeah, yeah, I understood
You will
that.
get all the opportunities, everything basically. Even there's a 5,000 population in a small town, you will get all those things.
Okay, sir. So after AMC 1, once we pass and you work as a JMO, when will be able to write AMC 2 or WPA?
Anytime you can write, but the
Okay.
good time I can say after at least 3-4 months, you can
Okay.
prepare for yourself. At least, but in generally, लोग like 5 to 6 months के बाद देते हैं.
Okay, so after I write the WPA
hello,
or
hello.
AMC 2, how
Yes.
long will I, like you said something about internship experience, 1 year I'll have to do. What was that about?
No. I mean, for you, no need to do internship.
Okay, I don't have to do it after AMC 2 or WBA.
No. AMC 2, everyone has to go.
Okay, okay.
AMC after 2 year, everyone has to go. That is 1 year, or this is minimum. And
Okay.
with it, there is a body called APRA.
Okay, I
APRA,
have heard of that, yes.
APRA will see your CV, your individual, CV, your work, and all those things.
Okay.
And they will decide how many hours you need. But in
Okay.
general, they give for 1 year for Indian medical graduate.
Okay, sir, how long will this entire process take?
Basically, you are getting salary by this is a job basically. So you are in the training.
Okay.
So yes, so this is not free. You are doing internship, or just GMO job also is a paid job.
Yeah.
Yeah,
No, I was asking how long will this entire process take, sir? Like from writing AMC 1 till becoming an RMO, how long will this entire process take? Like 2-3 years? How long will it
it
take?
is up to you when you can pass this part two. This
Okay,
AM.
okay. Sir, after
So
you pass AMC 2 or WBA, when will you know?
yes, then once you pass AMC part 2 or WBA, and then this 1 year you need to work. Okay.
Okay, that 1 year
Then,
internship that they're telling. Okay.
yes, then you need to apply for skill assessment, we call, and then you are ready to apply PR with.
Okay, and regarding the English exam, do you have to write the general category or the academic category?
Because you are doing registration thing.
Okay,
So
okay.
any registration with APRA, any healthcare practitioner, medical
Okay.
doctor, pharmacist, nurse, physiotherapist, everyone need to go academic English, academic PT, or academic IELTS.
Yeah. Okay, so can you get a PR after working as a JMO, like before writing AMC or WBA?
No.
You have to write that, then only you can get a PR.
Yes, basically that's a mandatory thing, because the body will see your assessment only after you did this.
Okay. Okay, sir. Sir, one more thing regarding the courses that you give, when will the new batch be starting? Like, how can I enroll in this course?
I mean, we basically, I think recently only we started last week or something.
Okay.
You can still you can enroll in that. But in general, if someone want to go another batch, then next month we start. Then we will shift in that batch. So it's up to
Okay.
you.
So, like,
Sir,
if
I
I
have
wanted to join a
completed
batch
OAT.
now, which batch would I join, sir? Like a new batch that's going to start next month or
नहीं,
an old batch?
तो अभी हम आपको प्रीवियस बैच में देंगे आज से
Okay,
यार
okay,
example you join today we will give
okay,
you today onwards you will get the access for our
okay.
current batch
So
but
you said this course will
after
be for 4 months, right?
yes and
How
then
much is this entire course?
after this is max 4 months
No, no, the expense. How expensive is it?
yeah yeah so and the cost you are asking
Yeah, the cost I'm asking.
the cost will give you our team basically so basically
Okay,
we have a ASAP scholarship you have to
okay,
attend that based on your score they will give you the cost
okay. Okay, if I wanted to
So I
join
have
today, who do I reach out to?
Yes, if you can just drop your phone number, email in the chat box. So
Okay,
right away our team will connect to you.
okay. Yeah. Thank you, sir.
Thank you.
I have completed OAT. Can it will work or not?
Yes, OET is acceptable, but OET is not required to write AMC exam.
Okay.
So
So
you can
later on
write,
it will work.
yeah, English exam you can write after AMC 1 also. Or if you want, you can write before also. So there is no such condition. The English exam,
So
you
I
can
have
write.
already completed OAT, so I asked whether
No, no,
this
it's
is
something,
useful or not.
yes, definitely it's useful. So if you can pass this AMC part 1 and when you apply for this APRA registration,
Okay.
obviously, it will help you. Yeah. You no need to
Okay.
go
Okay.
another a second time.
Okay.
Hello,
Okay.
sir.
Thank you.
Yes, hello.
Assalamu alaikum.
Welcome.
Sir, I just want to ask you one thing that my exam is in March, mid-March, for USMLE step 1.
Okay.
So I just want to ask you one thing that should I go for AMC if I do not pass USMLE step 1?
No, are you in which year currently in MBBS?
I have done my MBBS from China.
You have already done your MBBS.
Yeah, exactly. I'm graduated.
Okay, you graduated. Okay. So in that case, you can go basically this AMC. So basically, there is two things. If you want
sir.
to earn the money, or if you want to, in that case, you can
Yes.
go for AMC or PLAB. But if you want
Mhm.
to straight away this PG,
Mm.
then you can go to USMLE.
Which path is more easy? What do you say? What do you prefer, AMC or USMLE?
It will take around the similar years, whether it is US or Australia also, so because at least minimum 3 years or maximum 6 years.
I see. But I think so. What about AMC if I go to Australia? Should I give exam step 1 or then I go for Australia? Or should I do 2 steps in my country, then I can go for Australia?
No. Australia, the only country they allow to practice after part 1. Also, you are eligible to work, but you need to find a job or you can come any other visa to Australia, but you are eligible to work in Australia after part 1.
I have to clear part 1 just to go there, right?
Yes.
Okay. Same is with the USMLE, sir. If I pass exam step 1, then I do OET, then I go to USA.
No.
Isn't that?
अरे नहीं भाई.
No.
यूएससी एग्जाम
वैसा
लिख
नहीं
रहे हो
होता है.
आप बेसिक इन्फॉर्मेशन तो ले लो यार एग्जाम आप लिख रहे हो यूएससी.
Yeah. That's why I joined you, sir. That's why I joined you. And I'm
This
asking
for
you.
AIM, you are already writing the exam in March and you already prepared.
Yeah,
and
actually, no. This is the thing I just want to ask you that I'm from Pakistan. I'm not Indian, okay?
अरे यार कहीं से भी हो तुम्हें एग्जाम लिखना है नहीं लिखना है तुमको तो तुम एग्जाम
Yeah, exactly. I need to write it.
आफ्टर
Exactly.
exactly क्या होता है तो यूएसएमएलई में इन जनरल जो पार्ट 2 आप पहले करोगे उसके बाद में आप अप्लाई करते हो यूएस में और यूएस में जॉब नहीं होती है यूएस में आपको पीजी में अप्लाई करना होता है.
I know, sir. I know there's a fellowship for after step 3. I know that. Okay. So another question. Sir, I just want to ask you one more question. Can I?
Yes.
Sir, the part 1 of AMC, what kind of questions they ask? I mean to say, what means in USMLE step 1 they mostly ask from the basics and these things.
They all focus on more on clinical exam. जो clinical internal medicine, surgery, pediatrics, option gynae, ये वहाँ से ज़्यादा क्वेश्चन करते हैं.
All right. Okay, sir. Thank you so much.
Thank you.
Bye bye.
Good evening, sir.
Yes, good evening, Aditya.
Yeah, I've just completed my MBBS and done my internship. So I would like to ask you, I'm planning to write the AMC exam at part 1. And after that, you were talking about if we can write either AMC 2 or join for WBA. And I would like to know more about WBA, sir. How can we...
Yeah. WBA in simple word is like same like you are as a working as a CRI in India. As a internship you are doing. So in simple word, I can say you have to choose at least 4 to 5 departments. In each department, you have to work for 2 months. There is a one mentor for you in that particular. For example, you are for 2 months in option gynae, or 2 months for internal medicine, or 2 months in the surgery, for example, general surgery, right? So in this, there will be one mentor, and you also work in a team in that particular department or ward, right? So they have to do your assessment basically while you are working with those 2 months, So it is very easy, and there is 23 hospitals government of Australia identified. You only can work in those 23 hospitals. This WB program, and this
so what are the chances of getting into these government colleges?
These 23 hospitals only for IMGs. So you have to compete with IMGs only now. So there is no competition with local student will not come there. So WBA program only for IMGs. So international medical graduates only will fight for this.
Okay, sir. So once we get through the WBA program, so what are the areas they will assess you on? I mean, is it a clinical assessment, or is it the way we work and the interest we express?
All the things that they will see.
Okay.
Clinical also, your behavior to the patient, all those things, how you take care, or how you are performing the job, all those things.
Okay. And I'm interested in taking a PG in surgery, sir. So what are the chances of getting a surgery PG for an IMG?
You are Indian citizen. There is no chance for you to get a PG in India itself, and you are asking in Australia. So I can't comment on this. कि आपको मिलेगी या नहीं मिलेगी PG. Because
so I'd like to know if there is a high competition about that particular specialty, or
yes,
same for all the others.
Surgeon is the #1 highest salary. 3 CR they are making per year in Australia. I know. So there's a high competition in surgery. So in India, even you are Indian citizen not able to get a PG there easily. There's nothing is easy, I can say. But easy branches here you can like psychiatry, emergency medicines, all those things very easily because very low people are, not many people are preference. But I can say there are the hot branches in Australia, high demand for psychiatry and emergency medicine also. But surgery definitely have a good competition, I can say. So you have to beat. So इसमें I can't comment कि मैं आपको बोल दूँगा कि you will get definitely unnecessary, right?
Sir, same for medicine.
Yes, internal medicine is still there. Emergency medicine, very good chance, or psychiatry also very good chance, especially for IMG. I highly recommend to go for this because यहाँ के लोग तो ऐसे गोरे आते वो रहते हैं, तो इनको बहुत psychiatry की जरूरत रहती है. तो
सर, is there any expense benefit?
Expense benefit means?
सर जो जैसे हम इंडिया में जो एक्सपीरियंस गेन कर रहे हैं सर रेजिडेंसी करके.
डेफिनेटली यार आपको कोई वर्क एक्सपीरियंस है इंडिया का?
यस सर इसमें कोई डिपार्टमेंट भी स्पेसिफिक है लाइक वी आर वर्किंग इन इमरजेंसी और इन एनी नॉन क्लिनिकल डिपार्टमेंट टू गेट जॉब इन ऑस्ट्रेलिया?
दिस इज योर ऑन स्टोरी कि भाई आपने एमबीबीएस के बाद में यू वर्क फॉर 1 year इन सर्जरी क्लिनिक. नाउ यू टेक द स्टोरी, सर आई वांट सर्जरी बिकॉज़ आई वर्क 1 year इन इंडिया, आई डिड दिस इन दैट, माय इंटरेस्ट वेरी मच इन दैट. So you have to convince basically the panel here. This is not a exam here like NEET PG in India. Here you have to basically attend a interview. Okay. Here's the test and interview, and then they will choose. But I can say in Australia there is no discrimination among the IMGs or all locals.
Okay, sir.
Hello, sir.
Yes, Anup.
Sir, I am currently doing MBBS in Uzbekistan. I am in final year. In about 6 months, I will get my degree.
Okay.
Sir, what would you advise? Like, should I start the coaching from now? Like before 4 months, I get the degree.
Is a I don't know basically the standard of your university or the education. In general, this AMC required the 6 months is more than enough to preparation. If you have 6 months left, so I can say it's a good time for you. You can start your preparation, and once you complete your degree and then you can sit in the exam.
After completing the degree, you are
No. I mean, this is
satisfied.
the right time for basically anyone is doing internship, whether you are in India or any other country. So I can say the right time for you because you have a lot of free time, so you can
Okay,
focus
that's good.
this
Sir,
exam. Once
sir,
you
also,
graduate,
yes, sir. Also, they are claiming that they will give internship certificate. I'm in 6 years course. So, will it be beneficial? I am an
yes, it is
FMG.
mandatory. As I mentioned earlier, if you do not have internship certificate, then you need to complete internship first in Australia or India. In that case, then you have to go to that FMG. You need to write very long process,
Yeah,
right?
yeah.
But
Yes,
if
that's why
you
I'm
did,
trying to save time.
yes, if you did internship, then directly you can come to Australia. But if someone not completed internship, in that case, you need to go back to write this FMG, complete your internship in India, or you have to find an internship in Australia. And getting an internship really very hard in Australia because you need to compete with the local students. Okay.
Yes, right, sir. Right.
For this JMO job or RMO job, you are not fighting with locals
Yeah.
much. But for internship, you have to fight with the locals. So they will give obviously the first preference for local. Even in India itself, nowadays I recently have seen one news from Rajasthan. That some students are basically on doing a strike because there are a lot of students pass this FMG exam and government is not providing them this internship.
Exactly, sir. Yeah. Even after passing the exam, they are creating more problems.
Yes.
That's why.
So so save time and come Australia. Why wasting time here and there in India?
So, sir, no, because I was asking because your course duration is, I think, around 4 months, right?
No.
So, I have more 6 months remaining.
No, so then we give basically, that recorded sessions, we will give you the access. So we give basically 2 live class and so
Okay.
we give basically a 12-month access. It is not
Okay.
for 1 month, this is not, if you fail or not sit, we will still give you the access. This is not something like, no need to worry.
Okay, okay. Okay, that's what I was. Okay, thank you so much, sir. Thanks a lot.
Thank you. And please provide your email in the chat box so we can
Yes,
connect.
definitely. Definitely, sir.
Okay. Yes, Manan Vora.
Assalamu alaikum, sir.
Sir, good evening.
Good evening.
Sir, I'm an final year student. I'm a foreign medical student. And my question was, can I write AMC exam without giving FMG?
Yes, can write ऐसे बताया मैंने, but you must complete your internship. Anupam Singh, right? Okay, he is doing internship right now.
Like currently I'm studying in Philippines and
तो फिलीपींस में internship होती है नहीं होती है?
सर यहाँ पे क्लर्कशिप का प्रोविजन है सर.
हाँ तो क्लर्कशिप 1 मंथ की एक साल की होती है, कितनी की होती है?
1 साल की होती है सर.
हाँ तो वही बेसिकली वो नाम चेंज कर दिया 1 साल की. कुछ जगह पर some student basically they send us the document from I think Georgia here and there. So they are showing that 1 month internship, 2 month internship. So that is not an internship. 1 year, then you can consider, this is the internship. If you are doing like a 12 month and different at least 4 to 6 different departments, is considered as an internship.
Okay, sir. Thank you, sir.
Thank you.
Assalamu alaikum, sir. Sir, in India, we get our final degree after we complete our internship, right? So, can we book the AMC one before we complete our internship, or will we have to wait for our
भैया आपको
internship
डिग्री
to get
लेना
completed?
जरूरी है फरहान जी, डिग्री मिलना जरूरी है यूनिवर्सिटी से आपकी डिग्री
हाँ, sir?
चाहिए उनको. They need final degree.
Okay. So basically, to get the EPIC verification done, we need to wait for our internship to get completed. Then only we can do the process.
Right. Basically, in India, internship it is a part of your degree. It is not separately, right?
Right.
So आपको technically EPIC verification तभी होगा जब आपका complete होगा. But if you are in final year, तो आप preparation अभी से चालू कर दो, तो you can save lot of time.
Right.
Sir, I have done my internship from Pakistan. So can I give my AMC exam in Pakistan?
AMC exam, there is no Pakistan center. So you need to.
Sir, where can I give it then?
Dubai center is there, UAE.
Sir, what is the cost of AMC then?
Was around 2,900 around dollar, $2,940 the exam fees.
And sir, AMC 2 exam, where should I give it? In Dubai also?
No, that is you need to come to Australia or online also you can write. There's alternate also. And actually after part 1 you are eligible to work in Australia.
Sir, OET is required?
Definitely. Any country you are English test is mandatory. इंग्लिश में आप जा सकते हो IELTS पर, OET पर या PTE भी होता है ऑस्ट्रेलिया में. ये तीनों एग्जाम में एक.
Sir, how many times a year it is conducted in Dubai?
दुबई नहीं भाई, ये एग्जाम होता है हर मंथ, एवरी मंथ. AMC का एग्जाम मंथली होता है. तो whenever you are ready you can write. This is the advantage for Australia कि आप कभी भी you are confident to write the exam, immediately आप एग्जाम लिखते हो, तो 2 वीक के बाद आप एग्जाम लिख सकते हो. But if you are planning like UK, very difficult to get a date.
Sir, can we easily get a residency position in medicine in Australia?
भाई इजी कुछ नहीं होता है. इजी करना है तुम्हारे अपनी कंट्री में, तुमको नहीं मिलेगा. इजी कुछ नहीं
Yes,
होता है.
sir. Very tough. Very tough. Yes, sir.
Why you are asking what Australia is very easy? Nothing is
Okay.
easy. But definitely those have a high good profile. Definitely they will get. Even if you are
Sir,
not after MBBS itself, you are earning maybe 50 times more money as per your own country. So
yes, sir.
पीजी की मैं किसी का वो नहीं बोल रहा कि किसको कौन सा ब्रांच मिलेगा. इज बहुत सारे लोग यहाँ पर can get a admission after 1 year in PG.
So, sir, how much time I need to prepare for AMC 1?
4 months.
4 months. Okay, okay, sir.
We provide coaching for 4 months.
4 months, sir. Okay, okay, okay. Thank you.
Okay, thank you.
Hello, sir.
Yes, Srinivas.
Hello, Dr. Akram. This is Dr. Srinivas. I'm a pediatrician from Hyderabad.
Okay.
I have completed my MDA. Now I have 2 years experience.
Okay.
So what the pathway do you suggest for a person like me, like competent pathway or the normal standard pathway? Like,
I think you have to go to standard pathway because you just have 2 year experience. Like even as I give example to our own faculty, Dr. Swipnil Sharma. She's also MBBS MD from India, and she worked in India around 3 years.
Okay.
And then she applied for this pathway, AMC pathway, like standard pathway. So this basically this specialist pathway, they give the preference those have very high experience, 8 year, 10 year, 15 year experience, and they have a lot of publications, research. They are doing extra things, So they preferred for them, especially lot of competition from UK in that pathway. But national pathway have not much competition from UK.
Okay, okay. And what's the waiting period after AMC 1 for the jobs that we get?
Job, I mean, there is no such criteria for waiting. You just need to crack the exam. So it's up to you. It may take 1 week, it may take 1 month, it may take 3 months. So there is no fixed time, I can say, basically for the job.
Okay. So
but
like
after part 1, you are eligible to start looking a job. Okay. There is no any other country give this assistance. I mean, after part 1, you can work. In UK, you cannot work. In US, you cannot work. Australia only you can work after part 1.
Okay. And like for a person like me, like how easy is it to get a residency? So like the person who's already completed residency.
Yes. I can say there's a good chance for you to get a job. Also, very good chance to get a residency in pediatrics after you pass part 2.
What if I wanted to change the branch, like human medicine? Like what are the
then you have to make your own story. Basically, this is the things, why you already did in a PG in India, So you have to make very own story, very strong, I can say. In that case, you might need to change the. But if you want in pediatrics, very easily you can get.
Okay. So what's the ground reality of doctors there? So like how good is doctors' life? Or what's the future like? In India, like it's like saturated everywhere. So how is the market there? Like how do you see that?
Right now I'm talking to you. I think आप लोग देख रहे हो, आप लोग best doctors हैं. मुझे basically last 5 days I am suffering basically this viral fever.
Okay.
And it was basically holidays here. So
Okay.
डॉक्टर ही नहीं मिल रहा है यहाँ पर मेरे को. तो मैंने अपना इलाज खुद ही किया पैरासिटामोल खा खा के. Now I'm fine little bit, so I'm talking to you guys. So very difficult here to find a doctor. Very, very difficult. Otherwise you have to go to the emergency.
Okay. Okay.
Also here in
So
the system is totally different from India, because here the healthcare is free basically in hospital. So if
okay.
doctor calling 2 times, 3 times for me as a patient, I need to go and just meet to him, because I'm not paying any fees to the doctor. Doctor will charge the fees to the government.
Okay. Okay. तो वहाँ पे मतलब वेटिंग पीरियड भी होता है क्या सर पेशेंट्स के? लाइक जैसे
Yes.
यूएस में अगर किसी को अगर फ्रैक्चर हो गया तो उसको कभी कभार 1 मंथ का वेटिंग पीरियड दिया जाता है.
नहीं, ऐसा नहीं होता. यहाँ पर क्या होता है, आप इमरजेंसी में जाओगे फॉर एग्जांपल, और इमरजेंसी में फिर वो देखेंगे कि भाई 2 पेशेंट है, आप
Okay.
दोनों में कौन ज्यादा, किसको फर्स्ट प्रेफरेंस देना चाहिए, किसकी ज्यादा जान पे आई पड़ी है, तो उसकी बेस पे वो लोग असेसमेंट करते हैं. इतना यहाँ पर वो नहीं रहता. आई मीन इतना पॉपुलेशन भी नहीं है यहाँ. कितना पॉपुलेशन है पूरे ऑस्ट्रेलिया का? 3.5 करोड़ पॉपुलेशन है पूरे ऑस्ट्रेलिया का. और
Okay.
एरिया इंडिया से बड़ा ही है. आई थिंक यू ऑलरेडी नो गाइस, राइट?
Yes, sir.
3.5 करोड़ तो मुझे लगता है हैदराबाद में ही होंगे. दिल्ली में 3.5 करोड़ पॉपुलेशन है. मुंबई में 3.5 करोड़ पॉपुलेशन होगा एक शहर के अंदर इंडिया के.
हाँ yes, sir.
है ना? ये पूरे एंटायर कंट्री का इतना पॉपुलेशन है यहाँ पर.
Okay. Okay. Okay.
ये लोग WHO का जो फार्मूला है आप लोगों को पता ही होगा कि 1,000 कितने डॉक्टर होने चाहिए ना, तो ये लोग उसको फॉलो करते हैं. मिनिमम इनका रहता है कि भाई 2 डॉक्टर होने ही चाहिए 1,000 पॉपुलेशन पर.
Okay. Okay. Okay.
अब ये रेशियो इंडिया में तो 0.6 पे आ जाता है, और रूरल एरिया में तो ये 0.3 पे पहुंच जाता है, राइट? तो वहाँ वो एक अलग कंट्री है. हमारे सिस्टम जो है, जो पॉलिटिशियंस, उनको इतना वो फर्क नहीं पड़ता कि भाई वहाँ क्या चल रहा है. पर जो हाई इनकम कंट्री होती है, इनके स्टैंडर्ड इनको मेंटेन करना पड़ता है WHO के अकॉर्डिंग, वेदर इट इज US है या UK है, कनाडा है, ऑस्ट्रेलिया है. तो ये लोग बहुत हायरिंग करते हैं उस केस में. स्पेशली इवन सिंपल GP भी बन जाता नहीं है, तो वो भी ये बहुत ही एक्सीलेंट लाइफ रहती है इनकी.
Okay. Okay. Okay, sir. Okay, sir. Okay. Thank you, sir.
Okay, thank you, Dr. Srinivas.
Sir, what is the average salary of RMO in Australia after completing part 1?
यार सैलरी क्यों पूछ रहे हो बार बार एक के बाद? तुम्हारा सैलरी स्टार्ट होगा जब आप डॉक्टर बन जाओगे. तो RMO इज नॉट ए डॉक्टर बेसिकली, राइट? तो मगर फिर भी सैलरी आपको मिलेगी 4 से 5 लाख रुपए पर महीना इंडियन रुपीज में. अगर कैलकुलेट करो 100,000 के आसपास सैलरी मिलती ही मिलती.
Is there any demo classes?
Yes, you can talk to our team.
Okay, thank you.
Hello, sir. Shivraj this side, sir. Actually, I'll complete my internship right now.
Okay.
From India, sir. So I was planning to give AMC. So, sir, my question is that your team will help in AMC part 2 also, or it's just limited for AMC part 1?
Right now we are part 1, but we are also planning for part 2, and even we are planning to have our center in Delhi NCR. So we are trying to have कि आपको वहीं पे हम लोग प्रिपेयर करें part 2 के लिए.
Okay, sir. And after AMC part 2, sir, for that cover letter and that for interview also, your team will give some guidance, right?
Yes. हमारा और फैकल्टी इंडियन है, तो उन्होंने कैसे जॉब लिया वो आपको बताएंगे. So we are here to help you. It is not just कि CV कवर लेटर, इंटरव्यू में क्या क्वेश्चन करता है, कौन कौन सी वेबसाइट पे आपको जॉब ढूंढनी है, कौन कौन सी कंसल्टेंसी जॉब लगवा सकती है और इवन हमको भी जो भी इंफॉर्मेशन मिलती है वो भी हम लोग शेयर करते हैं अपने. और जो हमारे बच्चे ऑलरेडी पहले से किए हुए हैं एलुमनाई ग्रुप, वो भी आपका हेल्प करेंगे. तो ये सारा असिस्टेंट आपको हमारे साथ में रहेगा.
Okay, so it will be included in that if we buy the AMC part 1.
No.
Yeah.
We only charge the fees for course. This is
Okay.
this is the free services from Academically. This is personally made गाइड करता हूँ उसके लिए, क्योंकि आई मीन लास्ट मैनी इयर्स इन ऑस्ट्रेलिया, तो वो कोई प्रॉब्लम नहीं है आपको। इट इज नॉट दैट बेटा, वो हमारे पास में कितने 2000 बच्चे होंगे फार्मासिस्ट के, नर्सिंग के, और उनके हम सबको कराते हैं।
Yes, sir. Sir, last one question, sir. That AMC part one is objective, so most things it will get the success rate is more. But if AMC two, if we are not able to clear, so in that,
तो
if
इन आप जॉब तो आप कर रहे हो ना। फॉर एग्जाम्पल इफ यू कम टू ऑस्ट्रेलिया आफ्टर पार्ट वन, यू आर वर्किंग एज ए जेएमओ फॉर एग्जाम्पल,
yes, sir.
या यू आर वर्किंग एज ए आरएमओ वॉट एवर, ठीक है,
Yes, sir.
तो आप कंटिन्यू करते रहोगे, 1 साल हो, 2 साल हो, 3 साल हो, और उसमें सैलरी भी आपकी बढ़ती रहेगी। फॉर एग्जाम्पल उसने आपको हायर किया या 80,000 या 90,000 पे इनिशियली, इट गोज अप एवरी ईयर।
So, sir, RMO JMO का कोई ऐसे लिमिटेड टाइम नहीं है कि भाई इतने टाइम 1 year या 2 year, it is
नहीं, यहाँ पे लोग 5-7 साल तक वही आरएमओ ही रह जाते हैं। बहुत
okay.
सारे, हाँ, वो ऐसा कोई यहाँ पर
And
फिक्स
after that we can clear AMC part 2 and then the interview and then the PG process starts.
यस।
Okay, sir. Thank you, sir.
इवन यू कैन गो WBA प्रोग्राम आल्सो। मैंने बताया था कि 23 हॉस्पिटल्स इन ऑस्ट्रेलिया,
Yes, sir.
government hospitals, they are offering WBA work based assessment program. This is a very good program. There is no need to go to the AMC part 2, so you can shortcut this for AMC part 2. You can go in that pathway, and your competition
Yes,
among
sir.
IMGs only.
Okay, but sir, for that WBA pathway also there is some interview or an exam or something, or how can
Interview,
or we just have to apply it?
you have to apply an interview.
Okay, sir. Okay.
मगर वहाँ जो कंपटीशन होगा वो आपके जैसे बच्चे ही होंगे, वो दूसरी कंट्री का होगा, आप या इंडियन ही हो सकता है वो, है ना। तो वो और इन जनरली उसमें ज्यादा चांसेस भी रहते हैं ना। अभी तो पहले वो 15 हॉस्पिटल थे 2 साल पहले तक, फिर 19 हो गए थे, अभी अभी लास्ट मंथ से इन्होंने अभी 23 कर दिए, तो इंक्रीज करें, नंबर ऑफ हॉस्पिटल को बढ़ा रहे हैं वो
ओके, तो मतलब ये सर जो जिन लोगों को वो अपॉइंट करेंगे वो भी थोड़ा बहुत इंक्रीज हो जाएगा एज पर हॉस्पिटल इंक्रीजेस, हॉस्पिटल नंबर इंक्रीजेस।
उनका क्या हो रहा है बेसिकली, देखो इनको प्रॉब्लम क्या है, इन सिंपल से आप ये समझो, इनको डॉक्टर नहीं मिलते हैं इन द रीजनल एरिया।
यस सर।
तो ये जो हॉस्पिटल्स भी इन्होंने जो शॉर्टलिस्ट किए रीजनल एरिया में ही किए हुए हैं, तो इनको वहां पर भी स्टाफ चाहिए जो फंक्शन करने के लिए हॉस्पिटल, इसीलिए वो IMGs को वहां पर हायर, क्योंकि लोकल वहां पर नहीं जाते हैं। इवन जितने भी जो टॉप मेडिकल स्कूल हैं यहाँ पर इनके ऑस्ट्रेलिया में, वो सब मेन शहर में ही है, सिडनी में या मेलबर्न में ही है।
ओके,
वो लोग नहीं जाना चाहते उधर, इसीलिए ये IMGs को ये अपॉर्चुनिटी है कि भाई आप वहां पर जाओ रूरल एरियाज में।
ओके, सो सर WBA देन इट वो फिर एक्सपीरियंस का भी एक पार्ट हो जाता है, देन इफ आफ्टर AMC पार्ट 2 इट विल हेल्प फॉर द इंटरव्यू आल्सो, मतलब वो CV में इंक्लूड हो जाएगा ना वो, ऐसा कह सकते हैं।
बेसिकली आपने जैसे AMC 1 पार्ट किया, तो जो 23 हॉस्पिटल में आप वहां पर जॉब को अप्लाई करो, WBA अप्लाई मत करो। आप जॉब को उनसे बोलो कि मेरे को जॉब चाहिए, मैं आपके यहाँ काम करना चाहता हूँ, है ना। अगर जॉब मिल जाती है आपको उस हॉस्पिटल में, तो बहुत ही इजीली वो आपको WBA में ऑटोमेटिकली आप शिफ्ट हो जाओगे।
ओके, और WBA के बाद फिर सर PG का वो पार्ट तो मतलब
WBA और AMC इज द सेम, या तो आप AMC पार्ट 2 करो, फिर आपको फुल रजिस्ट्रेशन मिल जाएगा, फिर आप जाओगे उधर PG की तरफ, या WBA कर लिया आपने, फिर आपको वही रजिस्ट्रेशन हो जाएगा फुल आपका, और 1 साल तक आप फिर से वही रेजिडेंसीशिप करनी पड़ती है, और फिर आपको जो है PG में अप्लाई करना होगा।
मतलब सर फर्क इतना है कि AMC पार्ट 2 इज एन एग्जाम एंड WBA पाथवे मतलब वो पूरा 1 साल का वर्किंग एक्सपीरियंस है, दैट इज द डिफरेंस।
ऑन पेपर तो 8 से 9 महीने का होता है, पर इन जनरल वो 12 महीने करवाते हैं, बिकॉज उनको डॉक्टर मिलते नहीं है रूरल एरिया में, राइट। तो इसीलिए वो थोड़ा सा करते करते 8 महीने की जगह 12 महीने कर देते हैं, 11 महीने कर देंगे, राइट। मगर वो सिंपल फर्क भी देखिए, वो एक एग्जाम देना पड़ेगा उधर, इधर एग्जाम नहीं देना है। इधर एग्जाम क्या है, इन द सेंस एग्जाम यहाँ भी होगा, पर यहाँ का वो जो आपका मेंटर होगा वही आपसे इंटरव्यू काइंड ऑफ क्वेश्चन कर लेगा, एक पैनल टाइप का, वो बहुत ही इजी रहेगा, वो ऐसा कोई वो नहीं। जैसे इंडिया में क्या था, हम लोग वाइवा देते हैं ना ऐसे उसमें, तो इस टाइप का रहेगा वो।
मतलब WBA के बाद की बात कर रहे हो ना सर? हाँ, उसके बाद ये इंटरव्यू जो मेंटर होगा वो इंटरव्यू लेके फिर वी कैन गो फॉर PG।
WBA में बात कर रहा है, WBA में भी
हाँ यस सर, उसी की बात करो। यस सर, मतलब WBA में मेंटर ने इंटरव्यू लिया, उसके बाद वी कैन आफ्टर 1 year वी कैन गो फॉर PG थिंग, राइट?
यस यस।
एंड आफ्टर फॉर दैट आल्सो वी हैव टू गिव अनदर इंटरव्यू, मतलब 2-3 इंटरव्यू होंगे।
नहीं, फिर तो जिस ब्रांच में आप जाओगे, जिस स्कूल में जाओगे, तो हर जगह का अपना इंटरव्यू होगा ही होगा।
ओके।
अगर आपको ऑप्शन गायनी में करना है तो ऑप्शन गायनी का जो स्कूल होगा वो डेफिनेटली आपसे छोटा इंटरव्यू लेगा और फिर उसको शॉर्टलिस्ट करेगा वो।
ओके सर, ओके।
उस टाइम पर यू एंड लोकल बोथ आर इक्वल, तो दोनों लोग उस टाइम पे फाइट कर रहे होंगे उस ब्रांच के लिए। अभी जो आप आरएमओ या जेएमओ के लिए फाइट करोगे, दिस इज ओनली आईएमजी के अंदर आप करोगे। या डब्ल्यूबीए में भी आप फाइट करो सिर्फ आईएमजी से, राइट। मगर जब पीजी को अप्लाई करोगे तो उस टाइम पर जो आपकी फाइटिंग होगी लोकल बच्चों से भी होगी, बिकॉज वो लोग भी तो पीजी करेंगे, आप भी करेंगे पीजी।
यस सर, ओके, थैंक यू सर।
हेलो।
यस डॉक्टर जय
जी, अस्सलाम वालेकुम सर। आई एम in IMG from Pakistan in final year of my med school.
Okay.
I would like to know that what are the chances in the surgical residency after clearing AMC Part 2?
There is no such chance, कोई ऐसा चांस नहीं होता, वो तुम्हारे अपने ऊपर ही है। यहाँ पर यूनिवर्सिटी ऑफ सिडनी के बच्चों को लेगा है, तुमको लेगा, तो कोई चांस नहीं होता। चांस आपका सीवी पे चांस होता है कि आपको सीवी में क्या चीज है। ये कोई वो नहीं है कि भाई तुमको वो पहले ले लेगा, कि रिश्तेदारी थोड़ी नहीं है यहाँ पर, या तुम्हारा कोई जानने वाला है कि भाई इसको रख लो उसको, अगर रिश्तेदारी यहाँ पे चल रही है। यहाँ कुछ चलता, कोई भी रिश्वत नहीं चलती यहाँ पर, कोई सिफारिश नहीं चलती ऑस्ट्रेलिया के अंदर। आपका सीवी जो है बस वही बोलता है यहाँ पर, आपका काम बोलेगा। अगर आपको दम है आपके अंदर, आपको ऑटोमेटिकली मिल जाएगी सीट, वेदर इट इज सर्जरी हो या कोई भी हो। ऑस्ट्रेलिया का ये एक बेस्ट एडवांटेज है।
अच्छा, ये सर्जरी पे रेजिडेंसी कितने साल का प्रोग्राम है?
3 से 6 साल।
3 से 6 साल।
हाँ जी।
चलो, ओके सर, थैंक यू।
तो वो देखो, ये इवन तुम्हारी अपनी कंट्री में तुम्हें नहीं पता कि तुमको ब्रांच मिलेगी नहीं मिलेगी, तो यहाँ कैसे तुम बोल सकते हो कि भाई मेरे को यही ब्रांच चाहिए सर। तो ये तो बात की बात रही। इवन अगर आप नहीं भी बने, आप खाली जीपी भी बन गए, तो अभी आप 2 CR कमाते हो, तो 2 CR इंडिया में कमाते कमाते लग जाते हैं 10 साल लग जाएंगे, वहां 20 साल कमाते कमाते बंदे को इंडिया में, है ना। तो वो आप देखिए कि आपको करना क्या है लाइफ के अंदर। इट इज नॉट जस्ट क्या मनी या जो है जो ब्रांच। बहुत सारे लोग जो होते हैं, जीपी की जो लाइफ होती है ना, वो बहुत ही 9 to 5 की होती है, मंडे टू फ्राइडे वाली। अगर आपको ज्यादा हेडेक नहीं चाहिए लाइफ में, तो आप जीपी बन जाओ। यहाँ पर बहुत ही, हमारे डॉक्टर साहब है यहाँ पर, डॉक्टर मजहर, पाकिस्तानी है वो जीपी है हमारे। तो वो इसलिए जीपी बने, बोले यार मेरे को बस मंडे टू फ्राइडे वाले बस मेरे को बस लाइफ चाहिए 9 to 5 वाली, मेरे को बस काम करना और बस अपनी लाइफ जीनी है। तो वो उन्होंने कहीं गए नहीं उसके अंदर। बाकी में फिर जो इमरजेंसी वगैरह, नाइट ड्यूटी और ये सब लगा रहता है ना, एवन सर्जन का ही वही होता है।
चलो सर, थैंक यू सर। सर मेरा मनी गोल नहीं है, वो सर्जरी इज अ पैशन, तो उस हिसाब से थैंक यू
तो
सर।
यार ये तो आप ऐसे आईएमजी हो, अब आपके अपने यहाँ पर ही तुमको नहीं मिलता। इवन हमारे यहाँ तो बहुत टफ है, इंडिया में तो एफएमजी का बच्चे एग्जाम ही पास नहीं कर पाते। एग्जाम पास कर लेते हैं, फिर इंटर्नशिप नहीं मिलती है इंडिया में। तो इंडिया में तो 10 साल लग जाते हैं एमबीबीएस, जो कब्जा करके आता है रशिया से, चाइना से एमबीबीएस, यू नो। तो इतना इजी तो वहां पर ही नहीं है। तो यहाँ तो आप ऑस्ट्रेलिया एक हाई इनकम कंट्री में आपको सर्जरी कैसे मिल जाएगी? सर्जरी मिलेगी अगर आपके अगर सीवी में दम होगा तो ही मिलेगी, ऐसे नहीं मिलेगी यहाँ पर सर्जरी या कोई भी ब्रांच।
ओके सर, थैंक यू।
थैंक यू। यस हमना।
Hi, sir.
Hi Julie.
Sir, I am a foreign medical graduate from Ukraine. Actually, I completed my MBBS during wartime, Ukraine-Russia wartime. So I did my internship, 2 months internship to do through online. So, but I got my internship certificate from a university also, and also I passed my FMC exam also in the last year. But till now I am waiting for my internship to get.
This is the main issue in India. Okay.
Yes, sir. For last 1 year, I'm waiting to get my internship, but some problem with my verification and all. So my question is, sir, with that certificate, I can apply for AMC 1?
Yes, you can apply.
Okay, so no need to wait for to complete my internship in India.
I think no need if you already have that letter.
Yeah,
you know,
yes, I have.
yeah.
Yes,
So
I
this
have the certificate.
this is basically, that APRA will see the individualized things, but in general, you are eligible to sit in the AMC exam. They will just check your degree is completed and you have internship, so you are eligible basically, technically.
Okay, okay, thank you, sir.
Thank you.
Hello,
Yes,
sir. I'm Dr. Vansh.
yes, Vansh.
May I say?
Yes, please.
Yeah, sir, actually, I'm saying some people choose a pathway to work in Australia via PLAB route. So, like, according to you, like, if we clear PLABs 1 and 2, or we do this AMC part 1 and then work in Australia, according to you, which one is better? Because I have heard that the PLAB pathway fee costs less as compared to the AMC exam fee.
No, it is considered more than double or more than 3 times. I can explain you how. So if you
Mm-hmm.
pass PLAB 1 and PLAB 2, you need to go to UK. You need flight ticket. You need to stay in UK for 2 weeks. You need to attend training for PLAB 2. So you are investing 3-4 times higher money as compared to AMC. Okay. So this is not something. But
Okay.
in Australia, in AMC, you can write from your home country. Even part 2 also you can write right now in your home country. This is an online exam nowadays. Even part 2 for AMC. So
Okay.
you have to go to UK. It's a lot of expenses for that, So
Mm-hmm.
उसमें ज़्यादा खर्चा होता है basically.
So, sir, like in Australia, जैसे for specialty courses, you said the residency varies from 3 to 6 years.
हाँ.
So, after these 3 to 6 years, like we are equivalent to SR, or we are equivalent to consultant. Like what, we are PG or
No,
we
no,
are consultant?
SR, PG we can say.
PG. Okay.
Yeah.
तो इसमें जैसे आप
Fellow,
कहेंगे कि सर्जिकल प्रोग्राम.
उसको बेसिकली फेलो बोलते हैं. ठीक है कि भाई
Okay.
ये सर्जन फेलो है, ये वन फर्स्ट में ईयर 1 2 3 उसमें होते हैं, ईयर 4 होते हैं तो इन जनरल फॉर एग्जांपल जनरल सर्जरी करनी है 4 ईयर का होगा. अगर कोई स्पेशलाइजेशन करना है तो फिर वो 5 साल 6 साल लग जाता है.
तो सर कौन सी स्पेशलिटीज इजीली मिल जाते हैं ऑस्ट्रेलिया में?
इमरजेंसी मेडिसिन, साइकेट्री मिल जाती है तो उस टाइप की इजीली यहाँ मिल जाती है. इंटरनल मेडिसिन में मिल जाएगी.
Okay. And they are equivalent to Indian PG, and we can access that degree and get registered in GMC also. GMC में भी approved है ना वो?
ये दिस इज 6 ईयर कोर्स. इंडिया में 3 साल का ही है, तो इक्विवेलेंट नहीं होगा. ऑस्ट्रेलिया इज हाई इनकम कंट्री. ऑस्ट्रेलिया का डिग्री, यूएस का डिग्री, यूके का डिग्री वर्ल्ड वाइड रिकॉग्नाइज होता है. आपको तो पता ही होना चाहिए बात. तो
हाँ जी सर, वो तो पता है एक्चुअली. मतलब आई मीन टू से कि मतलब जैसे ऑस्ट्रेलिया से क्लियर करते हैं हम, एंड वी डू देयर 6 ईयर या 3 ईयर प्रोग्राम. उसके बाद तो जैसे मिडिल ईस्ट हो गया या यूके हो गया, कहीं पे भी वो हम लोग एज ए पीजी रिकॉग्नाइज्ड है ना हर जगह.
यस. ये आप अपने रिसर्च खुद से भी करो, मेरे कहने से क्या जा रहा हूँ. आप तो लोगों सर आपकी तो कोचिंग है, आप कुछ नहीं आप बोल दोगे, है ना. दिस इज आल्सो यू ड्यू फ्रॉम योर साइड. एनीवन फ्रॉम कनाडा, यूएस, यूके, न्यूजीलैंड, इन कंट्रीज से आप कहीं भी करो, वर्ल्ड वाइड इसकी एक्सेप्टेंस है. आप कहीं भी कर सकते हो प्रैक्टिस, इंक्लूडिंग इंडिया. अगर आपको इंडिया में वापस भी जाना होगा कभी, फॉर एग्जांपल 10 साल के बाद, तो भी आप प्रैक्टिस वहां कर सकते हो.
ओके सर, थैंक यू सर.
Okay, thank you, Vansh. Guys, last 1 or 2 question. यहाँ पर 100 बज चुका है. AM in Sydney.
Hello, sir.
Yes, Hamna.
Sir, I want to ask. I am from Pakistan. Basically, I have 3 years experience post my house job,
Okay.
and I'm going to travel on my spouse visa in Australia. So, is it possible on spouse visa I can apply from AMC over there?
I mean, right now is a good time for you. You just start your preparation with us, and once you are in Australia, you just need to book the exam and can write the exam. And once you pass the exam, are you coming in which city? Your partner he's in which city?
Melbourne.
Okay. Yes, so Melbourne is a very good city, I can say. You will do a lot of jobs is there.
Okay, sir. And sir, it will be easy for me. Like I have my home country 3 years experience.
Very good,
Plus I have done my
easy for you, to enroll because you have 3 year experience. वो बहुत ही आपको help करेगा. और even I know you just need to just pass AMC part 1 only. आपको job यहाँ easily मिल जाता.
and sir, after okay, sir. Thank you. And sir,
ये हो सकता है job के लिए कि you might you go little bit far. यू नो। तो जो आपका पार्टनर होगा ही माइट बी नो, यू नो, बिकॉज ऐसा नहीं होता यहाँ पर कैसे अपने यहाँ क्या होता है, इंडिया पाकिस्तान में हर मोहल्ले में एक दुकान होती है, राइट, क्लिनिक होती है, नर्सिंग होम होता है, वहाँ पहुंच गए। यहाँ इतनी पॉपुलेशन है नहीं, यहाँ पर इतनी, है ना, थोड़ा दूर दूर चीजें होती है, पर definitely I can say very good chance for you if you have 3 year experience to get a job.
Okay, sir. And sir, PG के लिए in pediatrics, is it easy for PG ship over there?
देखो इजी कुछ नहीं होता, पर बट इफ सिंस यू हैव 3 ईयर एक्सपीरियंस, तो 3 साल में आपने क्या किया है आपके सीवी की बेस पे, और जहाँ पर आप जब पास करोगे, यहाँ पर आप जॉब करोगे, उसकी बेस पे कैसा परफॉर्म करते हैं। यहाँ पर इंटरव्यू भी होते हैं, हर एक यहाँ पर स्कूल होता है, मतलब ऑप्शन गायनी का स्कूल है, पीडियाट्रिक का स्कूल है, वहाँ आपको अप्लाई करना पड़ता है, फिर वहाँ पर कंपटीशन है, सिंपल सा ये है। बट you have very good profile.
But as such surgery से ज़्यादा competitive तो नहीं है pediatrics, like sort of?
नहीं, सर्जरी इज अ वेरी कॉम्पिटिटिव।
Okay.
सर्जरी बहुत कॉम्पिटिटिव है। मैं इसीलिए मैं बोल भी रहा था कि भाई इतना आप एक्सपेक्टेशन मत रखो, फिर बाद में फिर कहोगे सर ने बताया नहीं था, नो। तो वो बहुत ही कॉम्पिटिटिव, पर ये एक मीडियोकर कॉम्पिटिटिव है। पीडियाट्रिक्स और इंटरनल मेडिसिन, ये मिल सकता है आपके लिए।
ओके, थैंक यू।
सर्जरी पे भाई कोई भी यहाँ सर्जन के लिए वो आ रहा है, तो भाई ऐसा वो मत रखो, आपके उसके ऊपर भी है, आपके अपना सीवी के ऊपर, तो या।
And sir, 4 months is more than enough for
ये
preparation?
अगर आप 5 घंटे दोगे, 4 घंटे दोगे, डेफिनेटली मोर देन इनफ। अदरवाइज अगर आप उससे कम टाइम दोगे तो फिर थोड़ा सा टाइम बढ़ाना पड़ेगा, 5 महीने हो जाएंगे, 6 महीने हो जाएंगे, मगर
And sir, one more last question. OAT or IELTS, what is more preferable for?
No, anyone you can go,
AMC?
it is up to you, your preference, but my मैं बेसिकली हाईली रिकमेंड करता हूँ गो फॉर PTE। PTE एग्जाम होता है फॉर ऑस्ट्रेलिया, PTE एकेडमिक 1, तो हम उसकी प्रिपरेशन कराते हैं PTE की और OET की भी। तो जैसे हम लोग IELTS की भी कराते हैं, पर IELTS थोड़ा सा टफ रहता है, तो मेडिकल ग्रेजुएट्स को मैं PTE और OET रिकमेंड करता हूँ।
Okay, both are acceptable in situation like.
Yes.
Okay. Thank you so much.
But you need to choose academic one.
Okay, academic PTE, right?
Yes, PTE academic or IELTS also academic.
Okay, sir. Okay, thank you so much.
Thank you.
And sir, what details for the course?
Yes, you just leave your phone number, email in the chat box, so we will connect to you. Okay.
Okay, sir. Thank you so much.
Okay, thank you. Yes, Farman. किसी कोई लास्ट में क्वेश्चन है, प्लीज आस्क।
सर AMC पार्ट 1 क्लियर करने के बाद वीजा कितने दिन में मिल जाता है, PR जो भी होता है?
वीजा का कोई टाइम नहीं होता भाई। ये तो जैसे ही आपको जॉब मिलती है ना, जो पार्ट 1 के बाद PR नहीं मिलता है, PR मिलता है पार्ट 2 के बाद में। पार्ट 1 के बाद में आपको मिलता है वर्क वीजा, और वो डिपेंड करेगा, आपको अगर जॉब मिल जाती है तो वो आपका हॉस्पिटल आपको स्पॉन्सर करेगा आपका वर्क वीजा,
वो जब तक जॉब रहती है।
यस,
सही है। तो जब तक पार्ट 2 क्लियर नहीं कर लूं तब तक मुझे PR नहीं मिलेगा। सही है,
नहीं मिलेगा।
ठीक, ओके।
यूके में तो पहले प्लैब 1 प्लैब 2 करते हैं, और 3 साल वहां जॉब करते हैं, फिर अप्लाई करते हैं PR को। तो यहाँ तो फिर भी बहुत ही इजी जर्नी है ऑस्ट्रेलिया की PR की। Please provide your phone number, email in the chat box, so our team can connect to you individually. And we also have, I think, next week another webinar, so we will also send you the information. So and get in touch with us. So I think we can finish here. Siddharth?
Yes, we can, sir. Everything is okay, perfect, fine.
Yeah. Okay. Then, guys, thank you so much and good night. Bye. Take care.
Thank you so much, sir.
Thank you. Bye.